going to talk about movements and their planes and their axis they occur in. The first joint I'm going to talk about is the shoulder joint or the glenohumeral joint. First action we can do is we can do flexion and extension. This happens in the sagittal plane and the medial lateral axis. The next action we can do is abduction and adduction. This happens in the frontal plane and the posterior anterior axis. I can also do medial rotation of the shoulder and lateral rotation of the shoulder. This is done in the transverse plane and the longitudinal axis. The last action we can do is circumduction, which is this huge giant circular motion. This is done in more than one planes, and it's done in the longitudinal axis. The next joint we're going to talk about is the knee joint. We can do flexion of the knee and extension of the knee. This happens in the sagittal plane and the medial lateral axis. We can also internally rotate our knee and externally rotate our knee. This happens in the transverse plane and in the longitudinal axis. For our hip, we can do abduction and adduction. Happens in the frontal plane and the anterior and posterior axis. We can also do extension and flexion in the hip joint. This happens in the sagittal plane and in the medial lateral axis. The hip joint, we can also do rotation. We can do medial rotation and medial rotation and lateral rotation. This is done in the transverse plane and the longitudinal axis. We can also do circumduction of the hip, which is just the circle. This is done in one or more planes and it happens in the longitudinal axis. The next joint movement we're going to talk about is the lumbar spine. We can do flexion and extension. Happens in the sagittal plane and the medial lateral axis. We can also do lateral flexion. This happens in the frontal plane and the posterior and anterior axis. We can also do rotation of our lumbar spine. Happens in the transverse plane and in the longitudinal axis. We can also do circumduction of our spine, which is happening in more than one plane and can happen in the longitudinal axis. The last joint we're going to talk about is the shoulder girdle. First, we can do protraction and retraction. This happens in the transverse plane and the longitudinal axis. You can also do elevation and depression of our shoulder girdle. This happens in the frontal plane, in the posterior and anterior axis. The last thing we can do upward rotation of our scapula and downward rotation of our scapula. Happens in the transverse plane and the longitudinal axis. These are all the movements. Well, we get a good mark.